All right, guys, just a few things to cover today. Some new stuff that's going on in the legal world around COVID. You've heard me talk before about the twindemic that may be coming. So just things to be thinking about now. Obviously, the flu vaccine is currently available. Based on everything we're reading, the COVID-19 vaccine will not be widely available until sometime in 2021. What can you be doing right now to encourage your employees to get flu shots? We've talked in the past about, and we're still getting questions at MEA about mandating flu shots. So keep in mind, you have to have a good business reason, good health and safety reason to mandate flu shots. If some of your employees or all of your employees are remote, you're not going to have that good health and safety reason. But for the people who are present, you might want to think about it. The problem with mandating the flu shots, you've heard me say this before, is what are you going to do if people refuse, right? So you really need to think that through. Plus, if you are thinking about mandating either flu vaccine or COVID vaccine when it comes out, remember that there are ADA reasonable accommodation obligations and also Title VII religious accommodation obligations that you need to think through. But I think most employers will be better served by encouraging flu shots. It may not be too late to do a flu clinic. Get in touch with one of the big pharmacy chains. They're coming out and doing them. But if that doesn't work, think about your carrot and your stick. Could you give people an hour off to go get a flu shot? It's very easy. Sign up online at any one of the big pharmacy chains. You go in, you're in and out really quickly. So something to think about. And just getting people the information, I think, is half the battle. This is also a good time to be thinking before kind of the flu hits. How are we handling sick employees, right? We know that a lot of the symptoms that you have with COVID are similar to symptoms that you get with the common cold or that you get with the flu. So how are you going to handle every sick employee? Are you going to assume that everybody has COVID? And how is it going to look to other employees? You've got an employee who might have a fever and sore throat, goes home one day and they're back at work 3 or 4 days later without a test. So you need to really think through those issues. What is your screening process? Are your employees accurately reporting their symptoms? Could telemedicine really help here? If you have a telemedicine option for your employees, this would be a great time to republicize that, a great time for employees to be taking advantage of that. I think one of the challenges we have as employers is that we can get really good information out there, and I always plug CDC's website, your State Department of Health website, but most of us are not physicians, right? So if to the extent you can get a physician to weigh in, and the nice thing is back in March and April, a lot of physicians didn't really know the answers, but I think the medical community is getting more and more educated about this, just like we all are, and they have better answers for their employees now. And there also is more testing widely available. All right. A lot of other things, the calls that we're getting right now is we've got a lot of employers who are trying to bring people back to work. So we might have manufacturing employers who are trying to bring some of their office staff back, or we might have employers who have been largely telecommuting who are trying to bring at least a portion of their staff back on different days, because I think a lot of employers are feeling that they're losing the collaboration, right? They're losing those conversations that happen as you're walking down the hall or that you grab somebody during lunch. And so employers are trying to get folks back. So some things to think about, but if you are having a specific concern, if you're an MEA member, reach out to the hotline, reach out to me, let's talk it through. If you're not an MEA member, reach out to your employment attorney to talk about specific concerns. So you've always got to be worried about OSHA. If an employee raises a safety concern, they have protection from retaliation under OSHA as a whistleblower. And how do you combat that as an employer? You have the best safety plan you can have, okay? We do have one available on the MEA website in our Coronavirus Resource Center. Have your safety plan in place. Do all the things you're supposed to be doing about hand sanitizer and hand washing and masks and social distancing and plexiglass partitions. If you're doing all that good stuff and you're doing screening, that the OSHA concerns are less legitimate concerns. Also think about if the employee themselves has a medical condition that makes them more susceptible to COVID, teleworking may be a reasonable accommodation. You also may have an employee who can't wear a mask in the workplace due to asthma or due to anxiety. So think about your reasonable accommodation obligations. And then, of course, for employees who might have leave rights under the Families First Coronavirus Response Act, I know a lot of employees have burned through that time, but some still have it left. Keep in mind that FFCRA, unless renewed by Congress, will expire at the end of this year. So I imagine we'll see a lot of employees, especially those with school-age children, trying to get their FFCRA time in. So if the employee comes to you and says, I need to be home for my kids. That triggers FFCRA potentially, so you need to do that analysis. And then finally, this is the conversation. We're going to have a bigger conversation around this next week during our town hall. But I did want to point this out. We're 2 weeks away from the election, and whether you're in a virtual workplace or a physical workplace, we've been hearing from members that this is an issue. And so I wanted to give you a couple of tools to be thinking about right now. A lot of employers will think, oh, First Amendment, we can't stop people from talking about politics at work. Well, unless you're a government employer or a government entity, First Amendment generally does not give you those constraints. So you do have some power as a private employer to constrain the type of conversations that people are having at work, especially if you have a good business reason, right? So if employees are being distracted, if employees are getting into confrontations, if it's taking away from customer service, if it's taking away from employees' ability to do their jobs, you have a good business reason for giving constraints on that speech, okay? Think about an all-out ban. Is this a good time to say, okay, we're going to stop all political discussions? Well, maybe, maybe not. But even if not, pull out your non-solicitation distribution policies. You can at least ban solicitation distribution during work hours in work areas. But if you're going to do that, remember there's no exceptions. You can't make exceptions for the Girl Scout cookies. You can't make exceptions for the sports team fundraiser. So if you want to put a ban on solicitation distribution, even just for the next 2 weeks to try to quiet things in your workplace, you're able to do that. And then more steps to take. Monitor the workplace. Physical workplace, electronic workplace. If employees come to you with questions, complaints, concerns, you always want to be responsive to that anyway, but now is even a better time to be responsive to that. And don't shy away just because the conversation may have political overtones. Remind managers to report employee complaints, even if the complaint of conduct does have those political overtones. Again, don't shy away just because someone brings up a Black Lives Matter issue, or just because someone brings up an issue around reproductive rights. That may be something you still need to get involved in. And again, tell your managers and supervisors they should cut it with the political talk. They shouldn't be talking with their people who report to them and also with each other, because to the extent that employees overhear those conversations, as I always say during anti-harassment training, our managers and our supervisors model behavior for our employees. They set the tone. So you want to make sure that they're not having those conversations either. And this is a great time to remind employees, all of your speech, political, not political. We should be respectful of other people's views, other people's feelings. As I always say during anti-harassment training, treat people the way you want to be treated, right? So this is a good time to, if you can't say something nice, don't say anything at all. All right, I've mentioned this before, but I just heard from a member yesterday. They thanked me for doing these weekly webinars. They thanked us for all the help that we were giving them during COVID. And so just a reminder, if you're enjoying your membership, you can refer a peer. If a peer company joins, you get 20% off your dues, and you personally also get a $100 gift card for being the referral. And these can stack on top of each other. So you could conceivably get a free membership out of this, okay? And of course, Coronavirus Resource Center, it is still there. We updated the FAQs a couple of weeks ago. So please feel free to reach out to that. If you don't have a safety and health policy, as I mentioned before, really important to have that as we head into this twindemic time period. Go ahead and take a look at our safety and health policy, and you can customize that to your own particular needs. So do we have any questions come in?
No, I think that's I think we're still getting some coming in on the gifts and the gift cards and that type of thing. But no, great update, Amy, and we look to hear more next week as we get closer to elections and the do's and don'ts of in the office and the workplace. So thank you again for joining us today. If anyone has any topics that they would like to have us discuss on future, especially for 2021, feel free either in chat before we close this, or when we send out the materials, we're going to reply back. We are putting together our topics for next year, and we want to make sure everything's very relevant. So please, please let us know what those are going to be. Yes, and I just see someone wrote pandemic burnout and COVID fatigue. Yes, that is. Wish we had the answer on that one to be able to do a session, but maybe that'll be a roundtable discussion or another survey we can do at the beginning of the year. But no, that's definitely one. Thank you. Someone else is asking about how to get people active on the flu shots. I think like Amy said, I think promoting it, publicizing it, and if you let somebody do it during their work time, that's probably the best thing you can do. You know, most of the drugstores you can schedule in advance, so you know, find the most local drugstore to your office. You know, help, you know, let them know how to schedule it and give them the time off. That's probably the, you know, and again, I agree with Amy, it's very hard to make it a mandate. People have different views on that. So,
and
but
someone
again,
else put in, they put in, sorry, Kevin, somebody else put in Q&A that they were actually giving out a little gift to their employees who could prove that they got a flu shot. Something to think about.
yeah, it's amazing what a Starbucks card or a Wawa gift card does for people.
Absolutely.
It motivates me. All right, well, thank you again. Great discussion today. We love seeing the chat so active. And again, thank you to Amy and Margaret for hosting us again. Take care.